The San Lorenzo Hospital Foundation members, continuing with the pursuit of the vision to transform the Hospital of San Lorenzo in a model for healthcare service management in the country of Honduras, and in order to achieve the certifications of the services, have created and generated a strategy for the hospital's continuous improvement through 30 new development projects of infrastructure, improvement works, and equipment installations in different areas of the hospital. Install access control gates. We want to install gates with access code locks to improve access control to restricted areas. Emergency room rearrangement and separating the areas of gynecology emergencies and main ER. Habilitate gynecology guards. Enable another procedures room, fix damaged restrooms, and build waiting room for families. Rearrange and expand pharmacy. We need to separate the area, assure restricted access, install furniture, and expand storage for photosensible drugs. Preclinic construction, UFO rearranging, and construction of vaccination area. This project consists in separating the areas in preclinics, place them in outpatient area, and UFO will be moved all the way to the beginning of the hallway. Now vaccines will be placed in a new area that will be built adjacent to outpatient. This will be done to isolate the sick patients from healthy patients who come just for a control vaccine. Reorganizing and construction of administration area. Expand the work area. Construction of public restrooms. Build new restrooms to meet demand and give adequate conditions. Reorganize statistics and medical records room. Revise, file, and store the medical records. Install new furniture and cabinets as needed. Eliminate the front access to room. Hallway access to new public restrooms. Build a hallway to give access from inside the building to the coming new restrooms. Expand neonatal room. Increase area due to the increased demand. Remodel laboratory. This project consists of separating the units by area. Build janitor's room according to biosafety norms. Properly separate work areas. Install proper furniture for the equipment. Pediatrics room improvements. In the restrooms, replace current doors with stainless steel doors. Remodel hallway. Build a semi-isolated patients area and a private bathroom for the burned children. Isolated patients in hospitalization. Move the area to the end of the hall. Install surveillance cameras. Install proper furniture to comply with hygiene norms. Install separating devices between beds and open an emergency exit. Build a new and complete isolation room. Equipment center. To separate work areas, remodel room to comply with hygiene norms. Outside lighting. Install light poles every 30 meters to illuminate the facilities and have more security during nighttime. Perimeter wall. Finish perimeter wall to enhance security. Maintenance room improvements. It will be moved to a different area. Restrooms and hallways in hospitalization area. Remodel and separate restrooms. Separate actual area by user gender. Connect the area to the rest of the building. Designate a janitorial room. Laundry room. Improve the area and equipment for enhanced hygiene by improving the actual conditions of the floors, furniture, electrical system, and overall washing and drying equipment. Operating room. The purpose is to build a new operating room, build a new restroom and dressing room. Maternity shelter. Remodel the actual shelter to comply with regulations from the Ministry of Health. Includes dorms, dining room, kitchen, bathrooms, laundry, and others. Pathology. It is necessary to build a pathology ward. Ophthalmology. Build an ophthalmology clinic to treat eye diseases, cataracts, near and far sight, and other eye treatments. Landscaping. Reorganize exterior landscaping and build rest areas to give the visitors a better, healthier environment. In addition to the above tangibles, it is necessary to implement within the personnel a training plan about hospitals, national and international biosafety standards. In order to continue providing the Hospital of San Lorenzo with infrastructure works and equipment to respond with appropriate healthcare services to the people of southern Honduras, we are also requiring the below-listed equipment. Solid waste management. Implement a proper hospital solid waste management system, an industrial washer and dryer, autoclave and water treatment system using reverse osmosis. Currently, only the hospital has one autoclave, which is insufficient for the demand, and the water treatment system project will improve the operation of the autoclaves that are affected by the salinity of drinking water in the southern region of Honduras that continuously break down our autoclaves. Water treatment plant. Because the water in San Lorenzo is extremely hard and polluted with the presence of sulfur and heavy metals like lead, ambulance need to urgently purchase one because the current is in really bad shape. Oxygen plant. Currently, the hospital does not have this plant, causing overspending of good and high costs for the patient. All Hondurans should move on from success to significance. Once we are successful, we need to move to significance. And significance is to make a difference in the life of another person. Today we are very happy that we are making a difference in the lives of 260,000 very poor people who visit the hospital every year, and we will be even happier when other foundations start working in other hospitals in Honduras. Our foundation has a high commitment and passion to see the hospital entirely transformed and to be able to offer the most needy better life conditions and better health services. For all of these reasons, we are knocking the doors of your hearts and asking that you become passionate as we are. We are grateful that you become part of this team and that we enjoy the changes together. We invite you to visit our webpage, where you will be able to see our achieved and pending projects in detail. Through this letter, we extend a warm invitation to visit us at our beloved hospital and see all that we are doing to make it better.